Hi guys, welcome to Kelvin TV. My name is Nesche. Today, I'm here to teach you spoon feeding of an adult patient. So, the CEO of Kelvin TV himself. Now he is my patient. Yes.
Okay guys, so watch out.
So in spoon feeding, I'm here with my patient. First of all, I have to establish rapport and then explain the procedure to the patient. Mr. Kelvin, Pacho, good morning.
Good morning.
Na puma.
Pacho,
then I'm here. Say another on way.
Pacho,
okay. Then I'm here. Send your yana down. One say no. Why America crack? I feel so. You better bow say obey. Be didi. Your feminist. I'm not pay. Me na me barber. One say. I'm matching for a bar. The men are made a member to us one barbershop. The bread send a young down, and you will be an a bill. The sales of Bob said a bear, and to media may be dinner or have a baby as you. The sounds of one said, Doctor, no, as my measurement in my barbershop. And then you are near a day by a mooney and I'm there. Pacho, a bebo, a mooney still. So I'm done with explaining the procedure and then also establish rapport to my patient. I have to also provide privacy. Yes. And Mr. Kelvin, as a medical camera, and let me provide privacy. As I say, other patients now or more, and as
Hello.
Okay, so in spoon feeding, these are the requirements needed. So we have the food, we have the spoon, bottle water, we have cup, then we have mouthwash, we have napkin, alcohol hand sanitizer, and then we have a bowl containing of water, we have soap, and then we have the bedpan if needed. So if the patient want to urinate or want to use a cell, then you provide the bedpan. Mr. Kelvin, I want to say, now send me a pussy and I will flat on the meeting month. Yes, I am traveling a phone. And you really get in that, but maybe you don't feel comfortable. So before you feed the patient, you see the patient is lying down, and then you know that when eating, there is no need for you to lie down because it can cause what? Aspiration. So you have to elevate the bed for about 90 degrees, or if the patient feel comfortable in bed, yes, like sitting down position, something like that, yes. So before feeding the patient, you have to give the patient mouthwash to wash his or her mouth. Is that correct? Answer my mouthwash. But we will not a few years So you use the serviette to cover the patient. Nti serviette na me de akọba me patient ni ko. E de akọba se de be ya aduane no. Odi anya de emu na bi. Ba jo ati ase ana se emu na bi. Ana ntina. Ebi aduane bi ana ye kwan. Ana se bibi ade ye liquid. Nti betima de aka na ta ade. Ntina bi ya agu. Then you have to let the patient wash his or her hands. Ubo onzo a o person no adidi. Ana se wa na otete ma. Until before so get the another man, as all man here, elbow answer with soup and the water. So now, I'm done with all the assessment. Until I don't do something and my patient. Would me any now, I'm for the my patient. Until yes, I will get what now get the another my patient. So if the patient want to eat by his or herself, what the cardiac table bed, ever bread. It's a heaven, but who baby the answer, wow, baby the answer, so right now, you see a patient, or person on my head, ADD, until all the cardiac table bed, ever back. Send it here. It is a patient, no. Also, no, I bed, a bit, and bed, a beman. And Pacho, I want you now work for still. I know I'm the idea, I'm doing myself. Once I need movie, I need tea. Beginning a crank. The family be very good. I feel so in June. So, me and you I'm a guy. So, I want you to come on. When the patient is eating now, Ubo ha odidia opinsu. But I didn't know and go did you and quiet woman. Once a patient and a request is open to obey it. then you have to make sure the patient has finished the food. And I say, Abia, wame. So what I say, hey. But don't tell me, but say, wame. And the patient also wame. Then once a new baby, I would be there. Aduane ne ya ne bia de eyeye ano nti aduane bia ya na no nti bede na ken ana se wo tissue so a wo di tissue ba ya we use tissue now there dey what the proper patient no le no ana mo kama ayere amano bato wa be papa na se to papa mo. Then after say what paper patient no the lip on amano besa amano mouth wash ni bi no dey there asade a okuru na that is the mouth care. You all know say you did bia and me wo koda outside o say tutu say so at say nti mesa ma patient no mouth wash na asade there e dey okuru Instagram me ho say ya better say you come am man for you. Nti masa mo you say dey ya. I want to to hear you. My mom said in case more be na say infection bi ana be. And say am mo. Na say we bo accept dey ya. Kan say So I'm done with feeding my patient, then I have to wash my hands. So when you are done with feeding your patient, you let the patient sit position for 30 minutes. Then you make sure that the patient is feeling comfortable in bed. Okay guys, so we are done with the procedure. Then you have to discard your trolley and then you have to also document. Thank you for watching us, Kelvin TV. Bye bye.